towards NP and PA.
All right, Weaver also offers like a limited practical technologist certificate. Basically, this is if you are interested in radiology but you haven't gotten into the program yet, or you want to learn a little bit more about radiology. It's one semester. They offer classes 1 day a week. You learn about extremities, spine, skull, chest, and like podiatry. Basically, if you're looking to apply to the program, it gives you extra points when you apply. If not, at the end you can test for your limited boards and become licensed in limited radiography, and you can work at a clinic or at a hospital, and then you can take x-rays of those specific body parts. As a limited, you're not able to take x-rays of like abdomens and pelvises. You can't operate fluoroscopy or like the C-arm, you can't go into the operating room. But pretty much this is a really good introduction to the radiology program, give you an idea of what you do in radiology, and then if you do apply to the program, it gives you extra points. So we're both actually limited techs. We took our boards, and we've been working at McKay while we're doing our clinicals. We work there as limited techs too, so it's also a good thing while you're in the program.
Plus it's testing experience. That's probably a big part of what scares everyone.
Okay, and then we'll talk a little bit about like all the modalities that are in radiography. First one is mammography, which is breast imaging. Basically you use ionizing radiation to take 2D and 3D images of breasts, which help with detection of breast cancer. There's diagnostic mammograms and screening mammograms. Basically a diagnostic mammogram is if you have breast cancer, you're going in and they're like, it's like diagnostic, right? They're diagnosing you. Screening mammogram would be like every woman over the age of 45, they're supposed to go in and get their yearly mammogram. That's what a screening mammogram is. You're screening, making sure they don't have it. Here's some examples of what the pictures look like. On the left is a 2D mammogram, and then on the right is a 3D. Basically, as you can see, the 3D mammogram, you just get a lot more detail. So they would do these on people with like known breast cancer. Now the left was a screening mammogram that they actually saw cancer on. That little spot right there is actually cancer cells. And the thing with breast cancer, the cancer cells can be as small as a grain of rice. They're teeny tiny, which is why like specific breast imaging is so important, because it can be really difficult to diagnose unless you get these really detailed images. This is computed tomography, or CT. Some people call it CAT scan. Basically, it's another form of ionizing radiation that takes 3D images of the body. So in radiology, like what we do X-ray, it takes 2D images of your body. CT takes 3D images by this tube right here, this donut-looking machine. Basically, the patient moves in and out of that, and inside of that donut is a bunch of like X-ray machines. They spin really, really fast as it delivers radiation to you to get like a 3D image. So it basically takes different slices, or what's the word I'm looking for? Like projections. I don't know really the word I'm looking for. Of your body. You have a sagittal, coronal, and axial views. We also can inject contrast to help see like your blood flow. So down here are some examples of sagittal, coronal, and axial images of a brain. And then on the left, top left, you can see that's a 3D bone reconstruction. So if a patient comes in and they had a really bad fracture, they can do 3D bone reconstructions to kind of like piece together where all of your bones are, and then they send that to the surgeon, so then when they're in surgery they can have a better idea of kind of where your bones are at. And then this is an example of perfusion imaging. So this is like the contrast that we inject into their bloodstream. It flows through them and it gives us an idea of like how their vasculature is working. So this patient actually came in for a left-sided ischemic stroke. As you can see, this is the regular CT imaging. These really dark spots right here, that's the stroke. And then this is the perfusion image. And you can see this really dark purpley area, that's where there's no blood flow. So it helps, like all this is more normal looking, and that's like really decreased blood flow. So it can help with strokes.
So, magnetic resonance imaging, this is MRI. It's similar to a CT in that it goes from a donut shape to a really long tube shape. This is the one where people are always claustrophobic. But what it is, the machine spins around you really fast, but it uses magnets. So it actually does not create any radiation. It's really safe. They actually do pregnant MRIs all the time because they can't put them in a CAT scan or an x-ray. What it's really cool is that the magnet is super strong. I have a picture that kind of gives you an idea of how strong it is. But what it does is it pulls on the polar water molecules in your body, and based on how much water may be in a certain area will actually give you soft tissue detail. So it looks at more than just bones. As far as the imaging goes, what we have here is a spine. Anyone know which section we're looking at?
Lumbar.
Lumbar. Beautiful. Do you have a duck yet? There you go. So, x-ray is what we do. We do ionizing radiation. The photons go straight through the body, gives us a 2D picture. This one gives us details of bone. So you can see like your vertebral body, your pedicles, your lamina, and your spinous processes. We've got ribs up there. This one looks a lot different. So this one, like we said, is kind of in slices. So what this one is a mid-sagittal view. That slice that goes right through the middle. You see a lot of white in here. This white area is actually where there's a lot of water. So you have a lot of water in your abdomen area, a lot of water in fat, and then this big white area here that's in your spine is your spinal canal. So, in the spinal canal, all this white stuff, and you want to know what that fluid might be called?
Spinal fluid.
You got it. Also in there, there's this dark piece that comes down. It's kind of thready looking. What might that be? It is attached to your brain.
Spinal cord.
Spinal cord. Beautiful. So, this one's really nice for looking at nerves. So if you're having like a bunch of pain and numbness down one leg, they can see if there's any impingements on a nerve that's happening. It's just really, really detailed images. If you want an idea how strong these magnets are, that wheelchair was pulled from the doorway into the machine, and that distance is probably this far. So there's a 5-step screening process that anyone that goes into an MRI has to go through, because any piercings, any metal in your body, fragments, retained bullets will be completely removed. They will pull it right out of your body. My nose piercing would be ripped out of my nose.
Is it that strong?
Very strong.
Oh, it's super strong.
So like the 2,000-pound beds, like the big hospital beds that they have, can actually like get sucked straight in the machine. Yeah.
What if you have like screws or stuff like already?
Like from surgery?
Yeah.
Generally those are really safe.
Mm-hmm.
They might, in their screening, they might ask when they were put in. At everyone around our age, we're usually all pretty safe. They're most all MRI safe.
So do they have to like make a room out of like non-metal?
Mhm. Non-metal, it can get kind of tricky, especially with like ICU patients. They have to make like really long extension tubing for any IVs that they might have. I think their oxygen tanks are built of something different. It's
They have to have long extension tubing.
long extension tubing for oxygen.
Mhm.
So there's a lot. You had a question?
Yeah, really quick. So is the magnet just at one part of the machine, or is it all around the?
So I'm not sure 100% about the machine like mechanics. I think it's one of the most advanced machinery hospitals have.
I think like how I told you, like the CT machine like spins. I think this one spins too, but it's the magnet that spins versus like an X-ray tube that spins. So I think like the whole thing is kind of magnetic. But yeah, no magnets or any metal in that room at all.
So sonography or ultrasound. Everyone thinks of an ultrasound and they think of babies. There's a lot more to ultrasound than just babies. So this is another type of radiation that actually doesn't cause radiation. It's high energy sound waves. It's the same method that people will map out the bottom of lakes. They send out a really high frequency sound wave, it bounces off the bottom, comes back, and gives them a picture of the bottom of the lake. It's how dolphins talk to each other. It's how we get images. There's a few different types. There's cardiac, which we call echocardiography. That one, their whole job is just taking pictures of the heart, checking blood flow, checking pressures, all sorts of fun stuff. There is obstetric, so women's and fetal imaging. I'll show you pictures on this next one. There's medical. They can actually scan things like your appendix or your kidney or your liver. There's therapeutic. That one, there's not a ton to do with it, but they can actually break up like kidney or ureter stones by sending an even higher frequency sound wave through the skin. So obstetrics, this is what everyone thinks when they see ultrasound. We have our 2D. So what it does, we talked about slices in MRI and CT. When you hold an ultrasound, it's a probe that's about this shape, and it projects sound waves out this way. So that's the probe. You can see the sound waves coming out, and it gives you a 2D image. They get 3D by moving that, and it's kind of like mapping out the bottom of a lake, and they can actually get structures and see what the baby looks like. So, medical. This one is used all day, every day, especially in patients that can't have x-rays, MRIs, CTs. This one up here is actually pictures of a kidney. Sonographers, I think they're geniuses. I could never do what they do. I don't know how they see what they see, but we have the kidney here. It's that kidney bean shape. You can actually see like the collecting ducts where the urine collects in the kidneys. All this blue and red areas, they can actually do what is called a Doppler. Do any of you remember what the Doppler, is it a theory? I don't remember. Something like that. Doppler, they can essentially check blood flow. So anything that's red is going to be arterial, anything that's blue is going to be venous. Echo, these are pictures of strictly the heart. So you can see ventricles, you can see the right atrium, the left atrium. Again, I don't know how they see what they see, but
Okay, then this is radiation therapy. So this is a type of cancer treatment. So I think a lot of times when people think of cancer, they think of chemotherapy. Radiation therapy can be used in conjunction with chemotherapy or like surgical intervention to help kind of kill off those cancer cells. Basically, it's super high dose radiation to a very specific part of your body to kill the cancer cells. The thing about radiation therapy is because it's such a high dose of radiation, yes, it can kill your cancer cells, but it can also kill your healthy cells. So if you weren't careful with this radiation, you know, you could end up killing or paralyzing your patient. Like if someone came in and they had a tumor right by their spinal cord and, you know, you missed their tumor and hit their spinal cord, you paralyze them. Or in their brain, if you hit their brainstem, you could kill them. So it's really very specific, and radiation therapists work a lot closely with like a radiation oncologist. They work with dosimetrists and medical physicists, basically to make sure like that they've mapped out exactly where this tumor is, and they've mapped exactly where they want the radiation to enter and exit the body so that it doesn't kill any of the healthy cells. This is what the machine kind of looks like. It's this. Normally it kind of looks upright, but then like as the patient is getting treated, it turns like side to side, and the table kind of spins around too to help get the patient in different angles for that radiation to be delivered at the exact right spot. On that left side is kind of an example of what a mask looks like. Because it's so specific, when patients come in to get treated, they get treated like multiple days a week for usually like 6 to 8 weeks, depending on what their treatment plan is. But they have to be in the exact same position every time they come in. So if you're treating a brain tumor, like this patient over here, they create a custom mask that's molded to their face that will hold them in the exact same position every single time they come in. And then they have it marked exactly with these lasers. They mark it exactly where they're going to treat with the radiation. But it can treat brain tumors. I mean, they treat prostate cancer, bladder cancer, breast cancer, all different types of cancer with this. It's very interesting because like the radiation that we deliver to patients, we measure in kilovoltage. The radiation that's delivered with therapy is megavoltage, so it's a lot stronger, so a lot higher risk, but also a lot higher reward, you know, with the treatment of cancer.
So interventional radiology, I think this is the most fascinating radiology field, but this is what I'm going to go into. So that big C arm we talked about at the beginning, this is a similar function. So this, you think like, oh, surgical staff. Yes, but IR staff. So as an IR tech, you are the one that is helping a radiologist while you are running the machine as a radiographer. but also functioning as a surgical or scrub tech. This technology is really cool because they can go retrieve blood clots. They can do certain spinal surgeries now. There's some prostate stuff that they're able to go in and cut off blood flow to a prostate to reduce its size. They can create new vessels in the liver. It's a really fast, very fast changing science. The way they do it, they actually have catheters and wires that they'll insert into, let's say, like your internal jugular or your femoral artery or vein. And then they thread these wires up to wherever they need to go. They just track it with the x-ray the whole way. And then they're able to do whatever they need anywhere in the body that has a blood vessel. So this is actually an interesting case study that I found. So this patient had an acute onset of stroke symptoms. They had dysphagia. They were unable to create full sentences. It just kind of sounded like word salad. The imaging is interesting because this is actually the picture of a patient's skull and the blood flow through their brain. The big white areas, what they do is once they localize where they need, the machine cuts out everything that's not moving. You cannot see it. This big black areas, that's blood flow, because what they do is they do a run with the machine while they inject contrast. The contrast moves through the vessels, that's how they show up. Where these arrows are, you can actually see, like, there's a little bit of an outline here that should be a blood vessel about this big, but it's not. So they actually have a huge blood clot in that vessel. And what they were able to do is thread those wires up into their brain, up into that vessel, and suck out the blood clot that was in that area. And the patient actually had immediate resolve of symptoms. So they went from making absolutely no sense talking to complete normal sentences.
Right, and this is nuclear medicine. So basically, the difference in this with other modalities in radiology, like we deliver radiation through a tube, right? Like we send it to the patient. Now nuclear medicine is a little bit different in the fact that the machines we use aren't the thing delivering the radiation. We're actually injecting them with a radioactive isotope. So we inject that isotope with a tracer and it will track to like a certain organ in their body, their brain, their heart, their kidneys, their stomach, whatever you're trying to look at. And it gives you basically an idea of how that organ functions. So you inject it, and then you lay them on this table, and then this flat detector right there, that just picks up basically the radiation that's emitted from the patient, and you get pictures that look kind of like this. They're a little bit spotty, but that just shows you like how much radiation is coming out of the patient in different areas. Basically these red spots all throughout the body, they call them hot spots. Those are really active cells or organs, and so that's where a lot of the isotope will track to. So you've got like a lot of your glands and like your thyroid and stuff, that's where a lot of it will take up in. And your liver right here is a little bit warm, not too hot. But basically it'll show you kind of like the function of it. So they do it on like brains a lot of time and like your heart to kind of see how well it's functioning. Another thing that's closely related with nuclear medicine is PET-CT, or positron emission tomography. Basically, PET imaging also uses that radioactive isotope, and we inject it in their body and track it to a certain organ. This very left picture right here is what a PET image looks like. So this is like a full body PET scan. And you can see like their brain is really dark, their kidneys are really dark, and their bladder is really dark. And then there's this really dark spot right here. That's actually a tumor. So PET-CT is used a lot for cancer detection because when they inject the isotope, it acts similarly to glucose, which a lot of organs that are really active, or your cells that are really active, take up a lot of glucose. And so you can see like your brain is super active, so it's going to be really dark. Your kidneys are active because you know they're always functioning, filtering the blood. Your bladder is active, so that's kind of what those dark spots are. And then of course cancer cells are really active. You know, they're constantly dividing, and so that's how you can see the tumor right there. Basically, a PET-CT takes that PET image and it takes a CT image right here, and it lays it on top of each other so that you can see that tumor that's right there. Is that glowing spot? So used a lot for cancer detection.
So, education and salaries. This is a general area. in years. The radiography says that is for your bachelor's. Again, the program is only 2 years long. But after that, as far as years of school, mammography you'll do 3.5, MRI 4, sonography 4.5, and then entry-level pay. I actually think that these are out of date in like the last year. I would say add about $2 to each of those per hour. And that's kind of what you're looking at for your base pay. It could range up. I know some technologists in Utah that are making upwards of like $45 to $50 an hour, depending on where they work and what they're doing. So it's a pretty well paying field, especially because we have the fastest changing technology in all of medicine. So we have a lot of continuing education that we'll have to do once we graduate to stay up to date on it. That's why they pay pretty well, I would say. So, as far as landing a job, you are almost guaranteed a job in any of these fields, especially radiography. Emily and I, as we said, we also work at the same hospital we do our clinicals at. And in the x-ray department, I think the last 8 weeks before they got traveler techs to fill in positions, we were upwards of like 60 shifts short over an 8-week period. So, and those shifts are anywhere between 8 and 12 hours long, so a lot of missing hours. So radiography, you're almost guaranteed to land a job. The other ones, it just depends where you are, what state you're in, and the situation of the hospital. Mammography is a little harder to get into. It's a lot nicer of a job. No weekends, no holidays. Same with radiation therapy. So it just kind of depends where you're at. Utah's a really dense area for radiation therapy, just because we have the Huntsman Cancer Center. So it's a pretty big hotspot for changes in radiation therapy. But most everything else, radiology, is just expanding every day. So there's always a need.
There's definitely a need.
So, just to wrap it up, this is pulled directly from Weber State's, it's called their grad map, but it's the very top portion. We actually have papers for handouts for those of you that might be interested, of prerequisites. So, those of you that are taking like concurrent enrollment English, you can check that off your list, or calculus, you can check it off your list. Basically, you need your English, you need your math, and you need some sort of communications classes, which is usually like a public speaking or something along those lines.
Group work. Yeah,
Group work.
yeah.
And then usually intro to psychology. The biggest, heaviest weighted ones for the program, because they do it in points. So when they assign points, they want to make sure you have all those, that's minimum. You need your anatomy and physiology through the university. That one, most of those classes in the health sciences department are like almost copy and paste from your high school course. So learn a lot here, and then it'll be super easy once you actually get in. Reason why is A's or A minuses is what's get you in the program. Anything less than that makes you honestly a weak candidate, just because of how our program has been. When we applied, I think they had like 580 applicants, and they took 56. So it's a less than 10% acceptance rate. So just kind of make yourself competitive. There is a lot more options that Weber has been doing that we're even, like, it changes every day. So they are taking more and more students, so there is more opportunity to get in. But just a few things about Weber. We are known as the largest radiography program in the entire nation, because we have outreach locations. If you felt like moving or have a better chance of getting in, Weber spreads up to Montana and all the way down to Arizona. As far as clinical sites, if you're accepted to like the main campus for Weber, your clinical site, no matter where you live in Utah, could be from Logan to Riverton, possibly even Utah Valley. So it's kind of a where and how much you're willing to drive. We got lucky and got close to home. So as far as where Weber's ranked, we are nationally recognized as being in the top 5 roughly every year when it comes down to like whoever does the ratings. Generally we bounce off first and second with John Hopkins, and John Hopkins is phenomenal medicine, so it's kind of wild to think that we bounce positions with them. So we do have an advising email here if you have any questions. We also have the QR code that goes straight to the website if you felt like scanning it. Any questions at all?
So if somebody applies and doesn't get the lucky 52 slots or whatever, how often do they apply again?
So, again, it might have changed, you might have to check the website, but generally they accept applications January 10th of every year. And with every application you get, so let's say you applied, didn't get in, but applied the next time, you have more points just for applying the first time. So, I think Emily got in her third time, I got in my second time. So, more points. Other things that'll get you in a little quicker is any other healthcare certifications. So like your CPR, BLS, CNA, EMT, phlebotomy, any of those they will give you extra points for. So, or if you take the limited one that we talked about,
Oh
that's
yeah, that gets you extra points.
more points as well. In fact, probably heavier pointing than they say it is.
It gives you more than like having an EMT or a CNA. It gives you like half.
So,
But yeah, it is kind of unlike, most people don't get in on their first try just because it is so competitive. They give extra points to those who have tried multiple times, so.
So you're in essence stalling your education for a full year. What do you do in
I
that
wouldn't say
interim?
stalling, like I got my associate's degree while I was working towards getting into the program, so I already have my associates and then I'll graduate with this associate's. So I was still like furthering my education. I was able to take the limited courses and get my certification in that, and then just take kind of other health science classes and broaden my, horizons, learn a little bit more still. But
or if your GPA needs a little bit of cushion, you can take a class or retake.
yeah, I finished taking your prereqs, so yeah.
Any other questions for those that were interested? So,
What's the difference between a radiographer and a radiologist?
so radiologist goes through medical school. So we are the ones that take their pictures. They are the ones that sit in essentially a dark room with really, really high resolution screens. So like, remember how everyone's like 4K, 8K TVs are great? Theirs is 30K. So they can see a lot more detail, but they are medical doctors, they're MD or DO. Anything else?
Did you tell them what got you excited about this career?
So I always wanted to do something in like healthcare, like all through high school. I knew I wanted to go into healthcare, but I didn't know what. And I kind of didn't know too much about what healthcare options were outside of being, like a nurse or a doctor. I actually had a presentation in high school about radiology, and I decided to do an internship in it. I was able to do my internship at McCavey, and then that's kind of really what sparked my interest in it. And then I was able to do my LPT and then get into the program. So.
My story's long and convoluted, but I'll give you the short story. I actually, like Emily said, we had students come to our high school as well and do a presentation. That's what initially got me interested. I decided to do the pre-med coursework, went through a microbiology program, and on the submit page for signing up for the MCAT, which is the test you take before med school, I had bad juju and decided not to take the MCAT. Came back to this, got my limited, and now I'm here. In the meantime, I had worked in the ER as an EMT for 7 years though. So if you need to take time to figure things out, that's completely fine. So, yeah.
All right, you guys have enough information to write your career report? Any last second questions for these guys? Okay, let's thank them for coming. Leave your state, great. Woo. All right. Hey, I just barely put that on canvas, you guys. You can submit your career report as soon as you get it done. 1 to 2 pages, please. All right.